She reports feeling cold most of the time and has noticed her skin becoming dry and coarse. These are very, very characteristic features. On examination, her skin appears pale and cool to touch. There is puffiness around her eyes and her voice is hoarse. Laboratory investigations reveal thyroid stimulating hormone, the 20 milliliter per unit per liter, micromilliunit per liter. The normal range is 0.34 to 4.25 milliliter per liter. The free T4 is 4 picomole per liter. Normal is 10.3 to 21.9 picomole per liter. Now the question is, what is the most likely diagnosis for this patient and which biochemical pathway is primarily affected in this condition? Your options are Cushing syndrome, Addison disease, hypothyroidism, hyperthyroidism. Talking about gluconeogenesis pathway, glucocorticoid biosynthesis pathway, and the thyroid hormone synthesis pathway. Now, the features are characteristic for hypothyroidism, right? So when we talk about the elevated TSH level, it indicates the primary hypothyroidism, while low levels of the free T4 confirms thyroid hormone deficiency. So obviously it is a thyroid hormone synthesis pathway, otherwise TSH would have been low. TSH is higher, means TSH synthesis is normal. Hypothyroidism is characterized by decreased synthesis and secretion of the thyroid hormones T4 and the T3. Now, the clinical presentation which you have to remember to identify the clinical case includes fatigue, weight gain, constipation, cold intolerance, dry skin, coarse hair, puffiness around the eyes written as the periorbital edema, and hoarseness of voice. These are very, very characteristic features for the hypothyroidism. When you see these in the clinical case, immediately your mind should go towards the diagnosis of hypothyroidism. We have this flow chart to evaluate the patients presenting with features of hypothyroidism. You start with the measurement of the TSH, and depending on the level of TSH, whether it is elevated or it is normal, we further do some tests. For example, elevated TSH will require the measurement of free T4. If free T4 is normal, then it is mild hypothyroidism. Here you can do the TPO antibody test, or if the patient is grossly symptomatic, then you start the T4 treatment. However, if TPO antibody is not there or the symptoms are less, then annual follow-up can be done without doing some treatment. On the other hand, if the free T4 is low, then it is a primary hypothyroidism. If TPO antibody is present, then this is the autoimmune hypothyroidism and T4 treatment essential. If TPO antibody is less, then you have to rule out the other cause of hypothyroidism and then follow accordingly. If TSH values are normal, then you can suspect the pituitary disease. Look at the features. If the pituitary disease features are there, then you measure the free T4. And if it is normal, you don't need to do anything else. But if it is low, then you have to rule out drug effects, the sick euthyroid syndrome, and then evaluate for anti-pituitary function. On the other hand, if pituitary disease is not suspected, you don't need to do anything else. Okay, so this is about the hypothyroidism. Hypothyroidism is a common clinical case coming again and again in your exam. So here we've discussed everything about the hypothyroidism. Question: a patient presents with extreme swelling and tenderness in the joints of the extremities. Examination of synovial fluid extracted from the big toe reveals the presence of urate crystals and confirms the diagnosis of arthritis. The drug was prescribed which relieves symptom by mechanism of competitive and suicidal inhibition. Identify the drug from the options given below. Your options are allopurinol, NSAIDs, colchicine, arginine. Now you know that in this case the drug which relieves symptoms via mechanism of competitive as well as suicidal inhibition is allopurinol. So your answer here is allopurinol. And when we talk about the treatment of gout, what are the approaches that we take? You reduce the dietary purine intake, restrict alcohol, and somehow you increase renal excretion of urate by uricosuric drugs which decrease the reabsorption of uric acid from kidney tubules like probenecid. You can also reduce the urate production by giving the allopurinol, which is the analog of hypoxanthine and is the very well-known suicide inhibitor. Okay, allopurinol is a complete inhibitor of xanthine oxidase and it also undergoes metabolism. Therefore, it is a suicide inhibitor. Colchicine, which is mentioned, is an anti-inflammatory agent. It is useful to arrest the arthritis in gout. Question: 30-year-old woman presents to her physician with muscle weakness, fatigue, and exercise intolerance. Physical examination reveals hepatomegaly Laboratory investigations show elevated levels of lactate and alanine along with hypoglycemia. Which enzyme deficiency is most likely responsible for this patient's symptoms? Your options are hexokinase, G6PD, phosphatidylkinase 1, and the glucose 6 phosphatase. Now, somewhat confusion can be there when you read this question. Why? Look here. It says exercise intolerance. When you talk about exercise intolerance in terms of glycogen storage disorder, you think about GSD type 5 and type 7. But here the features of type 5 and 7 are not characteristically present. See, look here. The physical examination reveals hepatomegaly, not enlargement of the muscle. Similarly, laboratory investigations show elevated level of lactate and alanine along with hypoglycemia. In type 5 or 7, hypoglycemia will not be there, or if it is there, it will be very, very mild. Okay, so this rules out type 5 or 7, and anyway 5 and 7 are not there in the option, so that simplifies the question for us. So you are left with the answer glucose 6 phosphatase. We are dealing with the von Gerke's disease, where you have muscle weakness, fatigue, and the exercise intolerance. Okay, so glucose 6 phosphatase deficiency leads to the von Gerke's disease, and elevated lactate and alanine levels are indicative of increased anaerobic glycolysis and conversion of pyruvate to lactate and alanine due to inability to generate glucose from the glucose 6 phosphate, because glucose 6 phosphatase enzyme is not there. Clinical features of von Gerke's: recurrent episode of hypoglycemia, and in this case, if the individual tries to do them physical activity, there will be the fainting episode, easy bruising, nosebleeds, fatigue, irritability, delayed puberty, enlarged liver, and even kidney is enlarged, gout and stunted growth or failure to grow. So here you have the hyperuricemia also as a characteristic feature of the von Gerke's disease. Remember, von Gerke's disease is a condition of chronic hypoglycemia. So the features of chronic hypoglycemia: elevated fat-free fatty acid, elevated VLDL, elevated cholesterol. So these findings will also be there. Hexokinase deficiency would lead to impaired glucose phosphorylation and would not present with hepatomegaly. G6PD is associated with removal of free radicals, and it's associated with hemolytic anemia. PFK1 deficiency would lead to exercise intolerance, but is not associated with hypoglycemia or the hepatomegaly. If you look at the glycogen storage disorder, you can think about the type 1, type 2, type 3, type 4, type 5, type 6, and something known as type 7. Taru is the type 7. Okay. Question: a 25-year-old female presents with a history of a joint hypermobility, skin hyperextensibility, and the easy bruising. Upon further investigation, it is found that she has a deficiency of an enzyme responsible for synthesis of a specific glycoprotein. Which enzyme deficiency is most likely responsible for her symptoms? So your options are aryl sulfatase, N-acetyl glucosaminidase, beta glucuronidase, lysyl hydroxylase. Now, when you look at the features hypermobility and hyperextensibility along with easy bruising, then you are looking at the condition called the Ehlers-Danlos syndrome. Okay, specifically the hypermobility type, which is the type 3. Some hypermobility can also be seen in classical type 1 or 2. Okay, the enzyme which is involved here is the lysyl hydroxylase. Lysyl hydroxylase can be involved here. No, not lysyl hydroxylase, sorry, it is the enzymatic defect in synthesis of collagen. The stop, cut. What the fuck? Okay, stop streaming.